So I will start with my friend and a very close friend who is, even though based out of USA, but he is concerned about India, Indian healthcare system, public healthcare delivery system, about patients. So without wasting any time, I would like to call upon my friend Professor Ramaiah to kindly come up, who is our chief guest, to unmute and give his presentation. Professor Ramaiah.
Thank you, Mr. Raji, for the great introduction. We are admirers of your commitment to safeguard consumers from fraudulent business practices in India. You remind me of the efforts of Ralph Nader, 1970s in the United States, who brought the Consumer Protection Act to reality. Thank you for recognizing the fact that rare diseases patients are also consumers and giving me the opportunity to express my views on this subject. As disclosed this week, this year's budget is a snapshot summary of the government's economic vision. It is the major policy initiatives in the areas of growth and welfare to have entered into Amrit Kal, the 25-year long lead to India at 100. Before I share my thoughts on Union Budget 2022, let me set the stage in the context of rare diseases. While rare disease individual affect less than 1 in 2,000 people, there are so many individual rare conditions, at least 8,000 of them. They are cumulatively common and everywhere. Duchenne muscular dystrophy, neurofibromatosis, Huntington disease, and thousands of other conditions with the names you have never heard. You may not know the disease names, but I'm sure you know people living with rare diseases. A minimum of 6% of people live with a rare disease, equating to 400 million rare diseases patients globally. In India alone, the rare disease population could be 90 million, exceeding the combined population of Delhi, Bombay, Calcutta, Chennai, Bangalore, and Hyderabad. Please don't get surprised if I say it is true, a quote, rare diseases land, unquote, is the world's largest countries, China and India. 80% of rare diseases are genetic disorders. Often these diseases are undiagnosed. They are nameless. They are medical refugees without a home or state. Why so, you might ask? Let me answer this question the following way. First, the diagnostic odyssey. On average, it takes 5 to 7 years for a child with a rare disease to get a correct diagnosis, and sometimes decades in adults, if they get one and if they are lucky. Second, the therapeutic odyssey. Only 6% of rare diseases have prognosis alternate drugs therapies, not cures. Third, the monitoring odyssey. Only 5% of rare diseases have a specific code in the most commonly used medical coding system, ICD-10. If the rare diseases are not counted, we leave them with the feeling that they do not count. Isn't it sad? This year, there is every reason to expect a health-centered budget given the learnings of the 2 years of devastating COVID pandemic. In 95 minutes of presentation of Finance Minister, unfortunately, there is no mention of rare disease patient sufferings on the top of the burden imposed by COVID. The budget focus is on increasing the capital expenditures for expanding the economic infrastructure under PM Ghati Shakti scheme. Now let me come to the point where we are in India in the rare disease space. Until 1992, the term rare disease or orphan drug did not exist in the Indian literature. In 2018, we conducted a sample survey to understand our country's base knowledge of rare diseases. It will surprise you that 30% of people who have a college degree, including NRIs, have not heard the term rare diseases in spite of lack of minimum awareness. This year's budget has given no importance to the rare disease patient's health, while the rest of the world making it part of One Health. However, I must say it is consolation to note that at the end of 2021, the Ministry of Health and Family Welfare drafted a national health policy to treat rare diseases. Drugs and Cosmetic Act amended to include the terms rare diseases and orphan drugs. Also, rare diseases are included in the clinical trial rules of 2019. Further, expensive orphan drugs have permission to import under compassionate use. These are just to mention a few examples. We appreciate the government's support to the rare disease community. Let me comment on rare disease and common disease and their relationship to each other. In the current pandemic, the COVID has increased the needs and opportunities. Rare disease patients can reciprocally contribute to the benefit from the COVID initiatives. Government of India has started several projects to tackle common and genetic disorders much before the COVID pandemic. For example, vaccine derived from mRNA, artificial intelligence, and genetic sequencing have opened the new world and provided crucial benefits to the healthcare sector. While it is easy to identify genes responsible for rare diseases like muscular dystrophy or Parkinson's disease, the technology is becoming possible to identify certain cancer markers or even things like a heart disease using a gene editing tool called CRISPR-R. These are some of the benefits of rare disease research to common diseases. In 2016, Prime Minister Modi talked about gene editing and stem cell technology to cure blood disorders such as sickle cell disease after his first visit to Japan. Unfortunately, to this date, funding did not get into this year's budget as well. The pandemic has worsened the mental health crisis across in the world. Rare disease patients experience such distress all their life. There should have been a more significant investment in health research. However, it has seen a dismal 3.92% increase from 2,700 crores to 3,200 crores. Now, let me be a little bit more specific about what is happening in the orphan drug area. The generic drug industry has made India self-sufficient in manufacturing drugs that are no longer under patent restrictions. However, India lags behind providing the healthcare access the drugs under patent. It is unlikely that this scenario will change unless the government steps in and provide the needed incentives such as derived from the US Orphan Drug Act 1983 or similar incentives suitable to the generic manufacturers of India. The lack of interest in the pharma industry is due to the fact that investment cannot be recouped due to the small rare disease population. Therefore, to address these and other issues, we appealed to the CDSCO system to set up a dedicated office for orphan drug development to be away from the shadow of the drug approval system of common disease. In this regard, we are seeking the support of pharma companies to write to the DCGI, and we thank those who have already written. Now, another subject. It is an exciting time for pharma industry. Due to the pandemic in 2021, the government introduced PLI schemes amounting 7,000 crores to attain self-reliance and reduce import dependence on critical drugs. We are pleased to bring to your attention that orphan drugs are included in the PLI scheme. It is up to the industry to decide if these schemes are good enough to go after orphan drugs. Now, let me bring another issue to your attention, the medical device industry. Its current market size in India is estimated to be $11 billion. The medical device sector has been growing steadily at the CAGR 15% over the last 3 years. Unfortunately, it is not the current budget proposal. The medical devices range from simple, low-cost pH strips to complex devices such as MRIs. You may recall when COVID struck hard and no medicines were known to cure, medical devices such as ventilators have become the only option for survival. Medical devices play a significant role in diagnosing, preventing, and treating rare diseases to prevent the quality of life. As I mentioned earlier, current orphan drugs are only treatments, not cures. Therefore, we believe that sustained support of medical device ecosystem will accelerate the development of critically needed devices for rare diseases, thereby enhancing the care options for these vulnerable patients. Our recent proposal to a major medical device company in India received a positive response and was willing to work collaboratively to benefit rare disease patients. Now, insurance policy. There are many existing programs where rare disease could be included in the 2020 budget. The flagship Ayushman Bharat Health Insurance Scheme continues to be the same as last year with 6,500 crores. Unfortunately, rare disease patients are not eligible to Ayushman Bharat privileges. This needs to be changed. Now, in view of the time, one last point, as described by World Health Organization, universal healthcare is the single most powerful concept that public health has to offer. One of the goals of universal healthcare is to create a system of protection that provides equal opportunity for people to enjoy the highest possible level of health. It is the obligation of the government as a signatory state of United Nations Sustainable Development Goals to work towards universal health care. UN echoes that there is no universal health coverage without including the rare diseases. Now, finally, the rare disease movement is not localized in any one country. December 21st, 2021, a global grassroots campaign led by the rare disease patient community at 76th United Nations General Assembly at UN headquarters in New York secured the adoption of the first ever UN resolution and addressing the challenges of people living with rare diseases and their families. 54 countries sponsored the resolution and 193 UN members states unanimously accepted the resolution. Lack of time, I would like to complete with the following statement. Healthcare expenditure has been historically ignored during the annual budget, despite the claims made by the government to strengthen health system every year. The meager health budget that have been struck at about 1.5% of GDP for 1.3 billion people are the lowest among many developing countries. The budget should have made quality healthcare accessible and affordable given the healthcare system's national priority status. The healthcare sector is expected to be one of the heavy lifters to propel the nation's growth to estimated 9.27%. Remember, health is wealth. Thank you.
Excellent. Excellent, Professor. आपने ऐसा ब्यूटीफुल रोड मैप डाले हैं हम लोग के सामने। हम और आप जैसे जानते हैं कि आज से हम लोग का काम शुरू हो गया है। What we want to present to the government in the month of September this year for the budget to be seen in terms of 1st February 2023. And as you very correctly said, Amrit Kal, we are moving from 75 to 100 years, a vision of 25 years. And I want to take this opportunity on behalf of RJ's family and all my friends who have joined this webinar today to congratulate you and salute you for the work which you have done till now. Excellent work you have done, and you have reached some of the milestones like you explained in the UN resolution which has passed in terms of rare disease. We will keep working together, and I can assure you we will take it forward.
Thank you very much. Thank you very much, sir.
Thank you very much. And